Today, joining us, we have a guest presenter, and I'm very, very grateful to Liza for agreeing to come and present with us. So, Liza is a regional IPC manager for the Necare Group. She's, of course, a registered nurse with an IPC speciality, highly experienced both in the public and the private sector. And she's kindly agreed to come chat to us today about the microorganisms in the CSSD so that we can be more aware of our risk to ourselves, risk to our patients, et cetera, et cetera. So I'm very grateful for that.
Thank you, Zana, and good morning, and thank you for that introduction. Good morning to everyone on the call, and thank you very much for joining the session today. So I'm in presenter mode, so I'm not going to be able to see if there's any questions, so I think we'll leave that to the end of the session, if that's okay, and then you can put any questions also in the chat box. So as Zana's introduced our topic, we're going to look at microorganisms in CSSD and also just to know our risk. So this is not a microbiology lecture, but rather just looking at a few concerning microorganisms that we may encounter in our CSSDs, risks that they may pose, and then also to have a look at how we can mitigate some of these risks. So I'd like us to go on a little journey into an unseen world that exists within our healthcare facilities, where tiny organisms wield an immense power. So in CSSD, we often focus on the visible, which is the instruments, the processes, and the workflows. And as Anna has said, they've had many training sessions this year already, and I think we've joined quite a few of these sessions, and that's what we've really focused on in terms of CSSD processes. But lurking in the shadows are actually microorganisms that pose significant risk to patients' safety as well as staff health. So from antibiotic-resistant organisms to resilient biofilms, which we will delve into a bit later, they defy the conventional cleaning methods. Microorganisms can compromise patient safety, they endanger staff, and they undermine the very essence of sterilization. So today we would look at these risks associated with microorganisms in our environment. We'll explore how they can impact our patient outcomes, and maybe have a little bit of a discussion later on proactive measures to mitigate these risks. And I know there's always challenges in our facilities that we have, and I don't think any facilities is without challenge, but I think we need to work around them. Because I think knowing our risks, we empower ourselves to also make decisions, and we also try to transform our work processes within the CSSD. I think for me, the most important thing is that we need to ensure that when we look at the CSSD department and working with the instruments, we need to be able to say, and that every instrument that's come through the department has been sterilized and free of these microorganisms as far as we know. So staying true to being an IPP, I thought we always talk prevention first, so it's infection prevention and control. We want to be more proactive than reactive. So I thought I'm going to just start with the importance of infection prevention and control in our CSSDs. So infection control is a cornerstone of patient safety and quality in healthcare settings, and the CSSD plays a pivotal role in this mission. As the hub responsible for cleaning, sterilization, and distribution of medical instruments and supplies, CSSD directly influences the prevention of healthcare-associated infections. So with the increasing complexity of surgical procedures and the rise of multi-drug resistant organisms, the situation demands urgent attention as the outcomes are really critical. So I think here we really need to understand what our risks are and what our prevention strategies. I spoke a little bit about our multi-drug resistant organisms, which we're going to explore later on in the slides. But I think everybody this week is also celebrating World Antimicrobial Awareness Week, which we all know is a global campaign celebrated annually to try and improve awareness and understanding of antimicrobial resistance and encouraging best practices. So I think being involved in these campaigns and allowing our staff to also be involved in them, they understand the bigger picture of when we talk about multi-drug resistant organisms and antimicrobial resistance. So effective infection prevention practices in the CSSD not only protects patients undergoing surgical intervention, but it also safeguards our healthcare workers. Despite the advances made in healthcare, inadequate sterilization and disinfection of reusable medical devices, including our endoscopic devices, our respiratory care devices, and our hemodialysis devices, they still occur in many settings, which leads to our healthcare associated infections. So some of the stats that we look at: 1 in 31 patients has at least one healthcare-associated infection during their hospital stay, and around 70% of these hospital-acquired infections are preventable. So proper sterilization in CSSD can prevent our healthcare-associated infections, which are costly, they prolong our hospital stays, and they can cause and they can result in death. So by ensuring all instruments are meticulously processed and sterilized, CSSD helps create a sterile environment that is critical for successful surgical outcomes. I think adhering to our strict infection control protocols enhances the overall quality of care, it reduces the risk of complications, and ultimately contributes to better healthcare systems. I'm sure without a doubt that every facility has these protocols in place, and I think most often it's really going back to basics and really having conversations continuously with our staff around these protocols. And we can sometimes feel exhausted from doing this, but I think it's really important that our education continues in terms of empowering our staff with IPC principles and protocols. So I think now that I've outlined the importance of our IPC practices, let's understand some of these microorganisms that we see in our healthcare facilities, and specifically if we're looking at CSSD. So microorganisms are basically microscopic living organisms. So they're too small to be seen with the naked eye, and they require a microscope for observation. And always when I teach microbiology, I always say to the audience that imagine if we could see all of these microorganisms, what would we be doing? I think we would perpetually be living either at a hand basin, or we would be using alcohol-based hand rub to try and get rid of these microorganisms if we could visibly see them on our skin. So they include a wide variety of life forms from different domains of life. And I'm sure you've heard of your bacteria, your viruses, your fungi, and spores. They're found almost everywhere, including in air, water, soil, and within and on the human body. So with some microorganisms are beneficial or harmless, others can cause disease in human, animals, and plants. And that's when we start speaking about a pathogen, okay, which is a microorganism that can cause disease in its hosts. So pathogens are capable of invading the host's body, it evades its immune defenses, it multiplies to produce harmful effects, ranging from mild symptoms, and it can become life-threatening. So why focus on microorganisms in CSSD? I think microorganisms are the primary cause of healthcare-associated infections, as I've mentioned. So imagine every time a surgical instrument is used, it carries with it the potential for infection. The risks are high and the risks are real. So understanding these microorganisms is not just about knowing their names, it's about recognizing their behavior, their survival strategies, and their ability to disrupt the healing process. So in CSSD, your role is crucial. You are the frontline guardians against these microscopic threats, tasked with ensuring that every instrument that is processed is free from contamination. So
Just a point
understanding.
for a second, Liza. Guys, if you have any questions, we're going to get Liza to finish her presentation. Please feel free to type the questions in the chat box or comments you'd like to make in the chat box, and we'll get back to that as soon as we are finished with the formal section. Thank you.
Thanks, Anna. So understanding and mitigating risk, I think, is crucial for patient safety. So if we can just imagine a patient that's undergoing routine surgery, and that happens very often in our facilities, they expect a quick recovery, but sometimes it's weeks later that they're back in hospitals. Sometimes they don't even leave the hospital and they acquire a healthcare-associated infection. And this is caused maybe not by the surgery itself, but by a single pathogen that may have escaped sterilization. So how could something so small cause such a big impact? And I think for all of us, that's really worrying. And I always say, if we put ourselves in the patient's shoes, or if that's our loved one that's going for surgery, we would obviously expect the best outcomes. We know the risks associated with surgery, but we still want the best outcomes for ourselves or our loved ones, and it should still be the same for our patients. So understanding a little bit about microorganisms, the characteristics of the common pathogens in CSSD, a range of microorganisms can be accounted, especially if cleaning, disinfection, or sterilization processes are not properly executed. So these microorganisms include our bacteria that I'm going to start with, and the bacteria is broken down into gram-positive and gram-negative bacteria. So not going into too much detail around the bacteria, these are two major categories of bacteria, and they basically are distinguished based on their cell wall structure and their response to gram staining, which is a lab method that's been developed, I think, in the 1800s to identify whether it's a gram-positive or a gram-negative bacteria. If we just look at our gram-positive bacteria, most often they are susceptible to antibiotics like our penicillin, which target the thick peptidoglycan layer. And if you look at my slides, it's that thick purple layer that is on the outside, and that's where we want our antibiotics to penetrate. So the gram-positive and negative bacteria really is based on antibiotic selection as well. So some of the gram-positive bacteria that we look at is your Staphylococcus aureus. I think we're all very familiar with that organism, and it includes our methicillin-resistant Staphylococcus aureus. This is commonly found on our skin and mucous membranes, but it can cause surgical site infections if instruments are contaminated. The second example of a gram-positive bacteria is your Staphylococcus epidermis, and this is really part of your normal skin flora. We all colonized with this, but it is a major cause of device-related infections due to biofilm formation, and we'll look at biofilms a little bit later on. We also have Enterococcus species. This is often found in our healthcare environments, can also be responsible for our wound infections. If we look at gram-negative bacteria, and if you look at my little diagram that's on the right of the screen, you can see these bacteria are more resistant due to the outer membrane. So they've got the additional outer membrane that requires different antibiotics from your gram-positives. And here we would mainly use things like your cephalosporins or your carbapenems. So some of the gram-negative bacteria that we look at is your Pseudomonas aeruginosa, and I know they're tongue twisters if you're not dealing with it all the time, but this basically thrives in your moist environment, including improperly cleaned equipment or reprocessing water systems. And if you just think of your environment in CSSD in terms of moisture, the water content that we're using during the decontamination process, it's quite high. So these are things that we would need to look at quite closely within the CSSD. Our E. coli, which is your fecal contamination, can cause severe infections, and that we would address also when we look at environmental cleaning and hand hygiene. And then our Klebsiella species associated with hospital-acquired infections, especially in our immunocompromised patients. And with our Klebsiellas, we also look at our carbapenem-resistant enterobacterials. And those are important ones with our CRE, which I think there's been quite a bit of focus on, and still a bit of focus purely because of its resistant mechanism. We then look at spore-forming bacteria, and I'm sure we're all familiar with C. diff, and for a real tongue twister, it's Clostridioides that they've changed the name to, difficile. They're highly resistant to standard cleaning methods, and this is because they're spore-forming, and they're a common cause of healthcare-associated infections. So here we see patients with severe diarrhea from C. diff infections. And then we also have bacillus species, which form spores that are challenging to eliminate during your sterilization process. We now move on to some of the viruses, and our bloodborne viruses, I think we're all very familiar with it, is your hepatitis B and your hepatitis C virus. These can persist on surfaces and pose a risk during instrument handling. And then obviously HIV, which I think, are a lot more aware and wary about, especially when it comes to things like needle stick injuries, etc., and obviously transmission through accidental needle stick injuries. I think we tend to be a little bit more guarded with this. So though this virus is less hardy, it can survive long enough to pose a risk if sterilization fails. All know HIV is obviously present in blood, body fluids, and tissues on contaminated instruments. Does not survive long enough outside the human body. It's very easily inactivated by proper cleaning and disinfection. However, if there's organic material like your blood, it can shield the virus from sterilization if it's not thoroughly cleaned. We then look at some of the respiratory viruses like your influenza virus, and this can survive on surfaces from hours to days. And then SARS-CoV-2, which we all know wreaked havoc in our lives for 3 years from 2020. The virus is responsible for COVID-19. We know it was highly transmissible in nature when we first identified it. It had the potential for environmental persistence, and it's led to heightened infection control measures to ensure the safety of our patients and our healthcare workers. The next group that we look at is our fungi, and here we look at specifically Candida species, and Candida is a normal commensal in our gut, our mouths. It's common in healthcare settings, but it can also cause systemic infections in our immunocompromised patients, and these infections can be quite severe. The non-albicans Candida is increasingly resistant to your antifungal treatments. And here, some of the names that you would have listened or heard about is your Candida auris species. And I think many of us have seen that in our facilities. We also deal with another type of fungi, which is your aspergillus. This is really airborne mold that can contaminate your sterile environments and cause severe infections, especially in surgical patients. And then lastly is our prions, and I think the prion proteins, which is abnormal proteins causing diseases like your CJD. They're highly resistant to your conventional sterilization methods, and they require specific protocols and for decontamination. And I'm hoping all of our facilities have these protocols in place. It's not something that we see very often, but I think it's definitely alarming when there is any alert around prions disease. And I remember for myself, an example, I think when I first started in this post at a regional capacity in 2019, we had a facility where we've identified a patient with CJD, and I had to call Sana to get her to help me, because at that stage, you obviously don't deal with it all the time. So my knowledge wasn't also great from the protocols for CSSD. The patient had surgery, so it's quite an intense cleanup once we identified, and also tracking and tracing, and that's where our CSSD tracking and tracing systems are really important. So on this slide, I thought I'd just show you some of the persistence of clinically relevant bacteria on dry, inanimate surfaces. And this is really some of the common bacteria that you may have heard of, or you've seen patients with, or you've known somebody that's had infections with these. Acinetobacter, I think, is quite a common one, and we can see it can last from 3 days up to 5 months on a dry, inanimate surface. So if we just look at our surrounding areas, and if you can just picture your work environment and what that looks like currently in terms of from a cleaning point, I think it's really important then we place emphasis on our cleaning of surfaces, your equipment, etc. C. diff up to 5 months, our E. coli anything from 1.5 hours to 16 months. That's really a long time frame. Klebsiella, I just highlighted the common ones for us, 2 hours up to 30 months. I think that's really scary if bacteria are allowed to survive this long on surfaces. Our Mycobacterium tuberculosis, a day up to 4 months. Pseudomonas, something that we've spoken about earlier, 6 hours up to 16 months. And then our Staphylococcus aureus, which includes MRSA, anything between 7 days to 7 months. So I think this is really scary if we put a time frame on how long bacteria actually can stay and persist on these surfaces. And then when we have biofilms, in play, which we'll speak about, I think it gets a little bit more worrying for us. Group of organisms I would like us to look at is the escape organisms, and I'm really hoping that this is a buzzword that is in your facility, especially when there is infection prevention feedback and meetings and we are presenting what our profiles look like in our hospital. I think our escape organisms are ones that we target. It's obviously monitored quite closely globally as well. Our labs very often would give us our data for our region just to see also what is happening within that specific region with regards to escape organisms, and then we very much benchmark against hospitals and our regions as well. So escape organisms, if you haven't heard the term, it refers to a group of bacterial pathogens known for their ability to escape the effects of antibiotics, which make them a major concern in healthcare due to the role in multi-drug resistant infections. And there's an acronym for ESCAPE, which highlights the following organisms, which is your Enterococcus faecium, your Staphylococcus aureus, your Klebsiella pneumoniae, Acinetobacter baumannii, your Pseudomonas aeruginosa, and your Enterobacter species. So if these organisms escape the effects of antibiotics, it's worrying, because what do we then use to treat these infections? And very often it can lead to a high mortality rate in our patients. So they are the leading cause of nosocomial infections throughout the world. Most of them are multi-drug resistant isolates, which is one of the greatest challenges in clinical practice. And multi-drug resistance is amongst the top 3 threats to global public health, and it is usually caused by excessive drug usage or prescription, the inappropriate use of antimicrobials. And even if we look at our patients in our facilities and we look at the number of antimicrobials that they may be prescribed during that stay, it is really worrying. And it's more worrying than when patients have infections from surgeries. So trying to then treat these surgical site infections, and more especially when we then identify escape organisms, how do we treat them? So I think it's important that we understand the resistance mechanisms of these bacteria, purely because of obviously antimicrobial agents that are then required, and then what do we use for treating these patients. So I did mention biofilms, I think twice now already in my presentation, and what are biofilms? So they're really a structure community of microorganisms, such as your bacteria, fungi, or other microbes, they're encased in a protective matrix that they secrete. So they actually have this protective layer around them. They're often made of proteins, your polysaccharides and DNA. They allow microbes to adhere to surfaces and resist environmental stresses. So biofilms are highly resistant to cleaning and disinfection. They can harbor dangerous pathogens, making complete sterilization very challenging. So in the CSSD, biofilms can form on your medical instruments, your equipment, on surfaces, posing significant risks to infection control and patient safety. So how do we then look at biofilms so if we look at biofilms that are a challenge in your CSSD, preventing biofilm formation is actually more effective than trying to remove established biofilm, because if they're so highly resistant to already what we're using to try and kill them through sterilization or our disinfectants that we're using, I think it would definitely be better that we try to prevent this formation of biofilms by following our stringent cleaning, disinfection, and maintenance protocols. And we can definitely minimize the risk. So if we look at things like your complex instrument cleaning, and I think we've all listened to some of the lectures from Zana around our instrument cleaning, very often the complex instruments that we have would be our high risks for biofilm formation. So where can biofilms form? It forms on your reusable medical instruments, so your endoscopies, your surgical instruments or devices with lumens or intricate designs. Biofilms often form in crevices, hinges, or internal channels that are difficult to clean. So I think our cleaning methods within our CSSD is really important. And also the team that we have cleaning these instruments also need to understand what are biofilms, because remember, they're not going to be able to see this, but they need to be able to identify which areas in our instruments that we would be able to, that we would find them. If we look at our reprocessing equipment, which is your washers, disinfectors, your sterilizers, and ultrasonic cleaners, especially if they're not properly maintained, we're going to find biofilm formation. So always follow your manufacturer guidelines on cleaning and care of these equipment. And sometimes it's really scary when we look at this equipment in the CSSDs in terms of the maintenance of it and how is it cleaned and stored. Our water systems is another important one because they can thrive in your pipes, in your reservoirs and filters that's used in your cleaning and sterilization process. So what systems do you have in place to manage your water systems in your facilities? And then surfaces, so looking at your work surfaces, your trays, your storage containers, especially if they are not adequately disinfected. And I know most often our CSSDs can be the smallest departments within that theatre unit. And hopefully now with new builds of CSSD, we are allowing a lot more space. But for the older CSSDs, it's really cramped, and sometimes the work surfaces are very small. There's a lot of clutter within the area. So how does proper cleaning and disinfection then occur? And really cleaning and disinfection, I think, is another whole topic on its own that we need to familiarize ourselves with and understand the importance from just cleaning and disinfecting surfaces, equipment, etc., to prevent biofilm formation. So some of the risks posed by biofilms, so infection transmission, so they can harbor harmful pathogens like we've mentioned. If it's not removed, these pathogens can then survive sterilization and also infect our patients. There's increased resistance, so microorganisms within biofilms are up to 1,000 times more resistant to disinfectants and antibiotics. Also recontamination, so biofilms in reprocessing equipment or water systems can act as a reservoir, continuously contaminating your cleaned instruments. And then it also increases cost to our equipment because it can lead to damaged equipment. It can delay our operations, increase costs for additional cleaning or replacement of our equipment. So how do we prevent and manage then our biofilms? And like I've said previously, our thorough cleaning, being meticulous about cleaning of all your medical instruments before sterilization, and obviously paying attention to complex devices that have internal channels. It's important that we pay attention to that. Regularly maintaining our equipment, performing your routine inspections and cleaning and reprocessing of these machines and looking at your manufacturer guidelines. I think that's really important. And then looking at disinfection and sterilization, so the use of disinfectants and your sterilization methods. Sometimes we may need to even extend our sterilization cycles if it's highly contaminated devices that we're looking at. And then monitoring and testing your water systems, and we can also then look at surface swabbing to identify any microbial growth. And sometimes we only delve into all of this when there's sometimes a major outbreak or there's increased cases of surgical site infections, and then you find everybody in theatre or CSSD trying to obviously trace the steps to where the infection could have potentially occurred. So I think our biofilm management and how we prevent this from growing and colonizing our environment is an important one. So we're now going to look at transmission of microorganisms within our CSSD, and the pathways for infection spread. We look at direct contact and indirect contact. So for direct contact, the pathogens are transferred directly from contaminated instruments, equipment, or surfaces to CSSD staff or to clean instruments. And here we also look at improper hand hygiene practices. So handling soiled surgical instruments without proper PPE, failure to wash your hands between handling contaminated and clean items would be examples of your direct contact. Your indirect contact, where infection spreads via contaminated surfaces, equipment, or improperly disinfected items. Here we look at contaminated workstations or sinks in the decontamination area. Another big one is our cleaning brushes, sponges that we use, and I'm sure you can already picture what yours looks like in your CSSD, and hopefully it's nicely hung up and they're clean and they're obviously changed when they're due for a change. We also look at instruments that are not adequately cleaned and sterilized before reuse. That would also lead to our indirect contact for transmission of microorganisms. We look at aerosols and droplets as another pathway of infection spread. So pathogens are aerosolized and they spread during the air during cleaning or sterilization process. So airborne transmission can also occur, especially in poorly ventilated areas. So aerosol generation, we use a lot of high pressure water cleaning or ultrasonic washing and inhalation of these aerosols from improperly maintained cleaning or sterilization equipment, and also environmental contamination from splashes during your manual cleaning. So those are some of the pathways that we would look for your aerosol and droplets. And then we have high-risk situations in CSSD where we're reprocessing complex instruments with hidden surfaces, and then handling instruments with biofilm buildup that we spoke about earlier. So some of the infection risks due to microorganisms. So the key risks posed by microorganisms to patients, the big one being your surgical site infections due to one of it being contaminated instruments, and we're not just saying that this is the only cause for surgical site infections, but putting it into perspective in terms of our CSSD and microorganisms, this can definitely be one of the contributors, and this can lead to a high mortality rate. There can be cross-contamination between patients. increased antibiotic resistance from exposures to certain pathogens, and then virulent microorganisms that can survive the CSSD process can cause severe infections in patients, especially those who are immunocompromised. So if we look at how fast-paced our theatres are, and I think we can all attest to that in terms of the surgeries, the turnaround times between our patients on the table, and also reprocessing our equipment that we need for surgeries, the element of cross-contamination can occur because of us needing the equipment in a hurry, and hopefully we're not doing any flash autoclaving, or we're not trying to rush the process, and we do have enough equipment in order to manage our workload for the day, so that we have effective decontamination processes in place. So really the impact, I think, here for our patient risks when it comes to these microorganisms, it prolongs the hospital stay. There's always an increased cost to that. And as I mentioned, our higher morbidity and mortality rates that we do have. With the virulent microorganism that we look at, there's a high infection severity. There's obviously rapid disease progression, and then these can also have a greater risk of outbreaks when we do have these organisms. So risks in your CSSD, your unclean surfaces, contaminated water in your reprocessing system leading to spread of bacteria like your Legionella. So as I've mentioned previously, try and look at what is your hospital protocol for management of your water systems. So the common risks to CSSD staff, so our healthcare workers within the CSSD, there's always the exposure to bloodborne pathogens. I think that is a big one, and always at the top of our head, if we look at exposure, we're always thinking of hepatitis B, your HIV that we obviously can look at, and I think that would come the top of anyone's head, especially when there is risks that arises from handling your sharp instruments, example needles, or there's accidental injuries, and that's what we're always more wary about, rather than looking at also the microorganisms that we've mentioned that can obviously contaminate our environment. If we look at respiratory pathogens, we look at aerosols generated during cleaning or ultrasonic washing. They can carry bacteria like your Mycobacterium tuberculosis, your viruses like your influenza, your SARS-CoV-2, or fungal spores like your Aspergillus that we've mentioned. So aerosols generated during cleaning or ultrasonic washing can obviously carry these bacteria. So exposure to your multi-drug resistant organisms. So these organisms also pose a significant risk due to limited treatment options. Sometimes I think our staff don't understand the risks of these bacteria, and when we put it in perspective, we might be healthy and well, we're exposed to these multi-drug resistant organisms, it might not affect us. But remember, we also go home to our families and to our loved ones. And I think it's important our staff are aware that we can then carry this home with us. And we might have elderly parents at home. We might have immunocompromised family that we are staying with. And should they be exposed to these multi-drug resistant organisms, it can be detrimental to their health. So I think it's important that our healthcare workers understand that the picture is bigger than them just being exposed, but this can ultimately then go into their families and obviously be quite detrimental, as I say. So other risks for our healthcare workers, we know skin irritations and infections from direct contact. So if they're frequently handling contaminated instruments or surfaces, can sometimes lead to skin infections such as your dermatitis or cellulitis. Cuts and abrasions where skin breaks increases the vulnerability to infections from microorganisms, specifically like your streptococcus and your staphylococcus. And then there's also the psychological risk where there's chronic stress and fatigue. There's a high workload. We know it's really an environment where, as I said, it can be extremely busy. There's a high turnover. There's very stringent protocols that need to be followed. But there's also the fear of accidental exposure to these pathogens, and this can also contribute to stress and burnout. And then the room for error here is also a lot greater when our healthcare workers are in this space. If we look at our key sources of exposure, our contaminated instruments, so improper handling or inadequate pre-cleaning increases the risk of exposure. Our aerosols and splashes, we've spoken about this, generated during manual washing or ultrasonic cleaning or high pressure sprays, and then reprocessing equipment where there's poorly maintained washers and sterilizers that can harbor biofilms or aerosolize microorganisms, and then our surface contamination again as another key source of exposure where we look at our work surfaces, trays, and your packaging material. So how do we mitigate risks? And I think, again, this is really another topic where we've covered, I think, multiple times during also Zana's training sessions, from how do we use our PPE adequately to mitigate any risks of exposure. So I'm not going to delve too much into it, but I think we all know the importance of our PPE. Wearing your gloves correctly, your gowns, your aprons, your face shield, goggles to protect your eyes, your masks when handling aerosols, and ensuring that your PPE is correctly fitted and that they're replaced or damaged when contaminated. And I think this is a big one for our staff working in our decontamination areas, for them to really understand the importance of using their PPE correctly at all times. If we look at safe working practices, how do we handle instruments? So using your puncture-resistant trays, avoid manual scrubbing of sharp instruments where possible, and using our automated washing systems that we do have in our hospitals. Looking at our sterile zoning, how do we separate clean and contaminated areas to reduce the risk? I think that's an important one, especially in the older CSSDs, where sometimes there's no proper demarcation between your clean and your dirty areas, and it might just be a red line on the floor that separates those areas, and very much often it's from structural building structure. So I think for this process where we don't have separate areas, how do we then allocate staff working in the areas, and how then do we speak to staff around reducing cross-contamination? And then if you look at disinfection, you're regularly cleaning and disinfecting your work surfaces and equipment. So I think those are just some of the ways that we can mitigate risks. And then to stay true to being an IPP, I cannot not have a slide with hand hygiene, because I really think that our hand hygiene, and I think we all know, is the cornerstone for infection prevention and control. Our CSSD staff frequently handle contaminated medical instruments and equipment, making effective hand hygiene critical to minimize the risk of cross-contamination and to ensure a safe working environment. So when should hand hygiene be performed in CSSD? So we look at the 5 moments of hand hygiene concept and adapt it to CSSD. It would include before starting work, so at the beginning of a shift, before entering the clean areas, after handling contaminated instruments, after touching soiled instruments and surfaces, before handling clean or sterile instruments to prevent contaminated or sterilized items, after removing your gloves, so gloves may have microscopic tears or contamination on their surfaces, and then after touching surfaces or equipment, especially after contact with surfaces in your decontamination area. So just to try and adapt that to your 5 moments, I found that to be quite useful when I was looking up a little bit about hand hygiene and how can we promote this in our CSSD. I think our role modeling, so our supervisors, our senior staff should consistently also practice good hand hygiene and also hold staff accountable for these practices. We can have reminders, we can have visual cues, and I'm sure you all have posters near your sinks or dispensers to reinforce your proper techniques and moments. But how often do we revisit these posters with our staff? How often do we bring it to their attention, the specific steps that we need to also follow? And then we also need a feedback mechanism to try and promote good hand hygiene. So provide your staff with constructive feedback during your routine audits or even during your rounds within the CSSD. I think it's really important that we also give staff feedback in terms of if they've missed moments of hand hygiene, gentle reminders that we can speak about, and then also ensuring that we have adequate supply of soap, paper towels, and your alcohol-based hand rubs at all times. Because if we want to promote hand hygiene, then we need to ensure that we have the equipment that we need available to our staff. So in conclusion, microorganisms are an ever-present challenge given the high stakes of handling contaminated medical instruments and ensuring patient safety. Understanding the nature of these microorganisms include their ability to form biofilms and resist conventional cleaning methods. It is essential for effective infection prevention. So by adhering to the strict cleaning, disinfection, sterilization protocols and fostering a culture of hygiene and safety, CSSD staff can minimize risks associated with microbial contamination. Regular training, proper hand hygiene, equipment maintenance, and adherence to international guidelines ensures that CSSD functions as a critical barrier against healthcare-associated infections, and ultimately mitigating risks posed by microorganisms in the CSSD not only safeguards patients, but it also protects staff and contributes to the overall success of infection control programs. So knowing your risks and following these protocols are really important. In CSSD, every instrument counts and every detail matters. So knowing our risks allows us to protect the lives of those who trust us with their health. And thank you.
Oh, Liza, that was scary, is what I'd like to say. Thank you very, very much for the very, very enlightening presentation. I think, in the CSSD we are so focused on soil, patient debris, because that's what we see the most. And we know that potentially will cause infection. And of course, as you said, the microorganisms are microscopic. We don't see them. And we have become so used to the patient debris that we tend to forget what's in there or what's potentially in there. And I must admit, I forget about the surfaces. I forget about hand hygiene when I'm in CSSD. They don't tend to come to me naturally all of the time. So I think you've just highlighted a huge number of aspects. Aside from scaring us, I think you gave us a good list of what we can do to mitigate all of these risks. And certainly a lot of them are not things that we can't solve alone. This is why the relationship, the symbiotic relationship between IPC and CSSD is so critical. If you're in the CSSD, I'm assuming if you're concerned, how do you know that your sinks are clean or not clean, or do we have a sink management system going? Who I'm going to consult with? I assume I'm going to go straight to my IPC.
Absolutely, Zana, and I think that's really important what you say. And the one point that I forgot to mention is that we put so much of emphasis sometimes on theatre, on patients, on instruments coming out of a theatre where we have a patient with a known infection. So we know it's a C. diff infection or a C. auris, or it's a patient with Mycobacterium tuberculosis, and now these instruments are leaving that theatre. Patients had surgery, they go in a closed container to your CSSD. There's all sorts of practices that happens. But actually, all our patients, as we've mentioned, are colonized with different organisms. So it's the only reason we know the patients that have is because we've tested and we found significant pathogens. What about the ones where we don't do routine testing, or we haven't tested and we don't know what they have? So I would say that every piece of instrument that we handle should be treated like it's coming from a patient with a known infection. And I think that's an important one for us to also remember.
So if you apply that principle, you make the assumption that all instruments that are coming through your department are potentially contaminated with a pathogen. And that pathogen is a risk for the next patient, but that pathogen is also a risk for you in the CSSD.
Correct.
And of course for the environment itself. So if I toss it on the table, I don't clean the table afterwards, the next lot of instruments ends up there, the next person pops by, works with something on the table, scratches their eye, there's a risk. Am I correct?
Absolutely. I think that's definitely a huge risk, and it's something that I think our staff are sometimes unaware that when they are busy with whatever practices and they do then touch mucous membranes, etc., that can all be your transmission for whatever microorganism or whatever that you may have on your hands.
Thank you so much, Liza. So I don't have any questions in the chat box. I think you've overwhelmed us a bit here. I've had requests for access to the presentation. Of course, yes. As normal, we are recording this. We will be putting together a test. We will email out the recording or access to the recording, which will be hosted on SafMed Education's YouTube channel, along with a link to the post-webinar test. If you take the post-webinar test, we will provide you with a certificate of attendance as normal. And then, of course, it gives you the opportunity to share this with your staff members, with those people that couldn't be here today. And I think a really wonderful presentation and an excellent opportunity